Now, fillers and Botox are some of the most popular cosmetic procedures, but in some cases, complications can still happen. And that's why we have Dr. Susan Schroeder with Perfect Skin Dermatology here today. Thanks for being here.
Thank you.
So, fillers, Botox, and laser treatments, they're all well-known procedures, right?
Yes.
And they are considered minimally invasive.
Yes, they are.
But there are some risks, and what are some of those risks that we should be aware of?
Well, there are, especially in Colorado, we don't have a lot of regulations about who can do this. There isn't some sort of a specialized board that regulates this in the state. In other states, there may be. So really, there are many different laser freestanding clinics that are out there that are not supervised appropriately. So some of the complications that you can see with Botox are just asymmetry that can be created. You could have a drooping eyelid. Sometimes people can drop their foreheads. If you really get into very fine-tuning Botox, you can have problems with the smile, chin line.
Yeah, that's surprising because it is so common now. Just like with fillers, right? There are so many different kinds of fillers, but as you always, there's complications.
Right. So as far as filler complications you may not be aware of, what you're seeing right now is actually necrosis. This right here is the dropping of eyebrows. It's very subtle, but you can see from left to right. Here is a picture of an eyelid droop that can occur if it's not done properly. And this is another example of necrosis. And when I'm saying necrosis, what that means is basically if you do not know the anatomy, if you're really not doing things properly, you can actually get into an artery and you can occlude the blood supply to the skin and cause skin death. And sometimes, rarely, thank God, there are cases of blindness because there is some crossover between the vessels that supply the arteries of the vessels that supply the eye and also the skin.
That's so surprising just because, like I said, it is common, but would you say it's because of training?
Some of it is training, but it can happen to anybody. Even the most expert can have a complication. So the really important thing is that you have your treatment done by somebody who knows how to handle complications so that if something does go wrong, you can have it treated immediately because many of these complications, time is of the essence to correct them.
Okay, so that was going to be my next question. What can be done if there are complications? Get it taken care of quickly?
Yes, there are certain compounds that we can use that will dissolve certain fillers, not all fillers, but some of them. There are also some devices such as blunt cannulas that we can use when we inject fillers that will reduce the complications, certain techniques that will make it more safe than others, and also crucial is knowing the anatomy of the face, the way the vessels, the nerves, the veins all run. Really important in having a safe procedure.
Talk to me about chemical peels and those kinds of procedures. What are the risks with that?
Chemical peels could cause some scarring, prolonged redness, or what we call erythema, but also it can cause hyperpigmentation, and that's probably one of the most common side effects. Many patients will go in because they want to smooth their complexion, they want to even out their skin tone, get rid of dark discolorations, and they may have a paradoxical effect if not treated appropriately where they can actually be more pigmented after the procedure because of the inflammation and sun exposure. So you need to make sure that you're having a treatment that is properly done for your skin type, and also that the proper precautions are taken before and after the procedure to make sure you don't have any complications.
So you're a board-certified dermatologist.
I am.
And so for everyone else who does these kinds of procedures and treatments, are they all trained equally?
No, they are not, and that's because of the regulations. The regulations in this state are lax, and almost anybody can do it, and there are some extenders that will do it, nurse practitioners, PAs, estheticians, but it's important to have that done under the guise of a board-certified physician that specializes in cosmetics.
It's a lot of good helpful information. Where are you guys located so everyone can know?
We're located by the World Arena, actually, on Venatucci, right by Tinseltown, so South Colorado Springs.
All right, well, thank you so much for being here. And if you would like to get more information on Perfect Skin Dermatology, just head to their website, perfectskinderm.com.